So let me start here. This morning, I was actually just playing with our new mini sims and our new micro learning modules for this. So I'm so excited to share that with you. So this is assisted devices. This is a course that happens for us in the summer. It includes a lot of the basic fitting, wheelchair, transfers, bed mobility. It's a very motor skill heavy class. And so it wasn't too long ago that the faculty member, Grace, in fact, Grace and I presented last night to the PTA group. It was great to be together with PTA faculty. And she had asked me, hey, could we just film all of these things so that they don't have to look at pictures of how to fit a crutch or look at pictures of how to do a modified 3-point gait? I thought, well, that makes a lot of sense, that a motor skill can be learned by modeling after good videos. And so I'm going to take you directly into the app in just a second. I want you to know that we are carefully looking at the MPTE or the FSBPT curricular standards, right? The CAPTE standards, and trying to figure out, can we augment the classroom with good apps and good videos, particularly in areas that really would benefit from it. We don't need to build apps for everything, I don't think, but I think there are certain areas that absolutely apps can make learning so much better. And so you can see James has spent a lot of time looking through curricular standards with me, for me, and helping us to map out our app building strategy. So you can see that these apps are designed to help the students learn what they need to learn and also be better prepared for clinic as well as passing their board exams. So there were a few key questions that we had asked ourselves. One, how can I train students about these different assistive devices? This is generally a pretty noisy and chaotic lab. It's hard to regain control when you've got 72 to 74 students. And we thought there must be a better and more efficient way for them to learn about use of these assistive devices, for them to learn about gait patterns, and also about transfers and bed mobility. Is that something really that can be learned by reading? Or is there a way to pre-expose them to a lot of these techniques so that when lab comes, we can actually look at these videos again, we can demonstrate it in real life, and this would have been the second exposure to all of these techniques. So think about what that means. Again, usually when we come to this kind of lab, it's largely show and tell. I bring out the crutches, I talk to them about how to fit it, and everybody grabs crutches and practices with their partners. For something as simple as assistive device fitting, the students have watched all the videos before they came to class. Lab time is so much more efficient. They just take their app, everybody grabs the available device and starts practicing fitting because they've already the information's been preloaded into their mind. Then when it comes to the gait patterns, yes, we could pull up videos easily. In fact, it might be good for me to just take you right into the app here. So here, if you log in to your PhysioU app, let me just close this off here. If you log into your PhysioU app, you will see that you have the assistive devices app here. Now you can sort through all of these new apps that we've been releasing by just going up to the filter category, and here are some fundamental skills. So here is the list of what we've put in the fundamental skills. And here is your assistive device fitting. I also would, I'll point this out in 1 second once we take a look at this app. Here, the students have watched all of these videos before they even come to class. So actually, let me go back one. Let's go to crutches, axillary crutches. In fact, let's do loft strands.
In order to correctly adjust your patient for the loft strand crutch, there are 2 steps. The first step would be adjusting the handle height, and the second step is adjusting the cup height. To first adjust the handle height, you will first have your patient stand up. With the crutch by the patient's side, you will adjust the handle height to the level of the patient's wrist crease. As you can see here, the handle is too high and needs to be lowered to the level of the patient's wrist crease. In order to adjust the handle height, I will first have the patient sit back down.
So you can see that this instructional video equips the student with everything they need to come to effectively function in lab. We don't even need to re-watch this in lab together. The students are ready to come and practice. So not only are the instructions here, but the students have this already as part of a lab handout. So let me show you what I mean by that. If I go here, go to PhysioU. Under the educator, faculty resources, there is some teaching content. Now you can get to it as faculty members through this sidebar. You see this sidebar here has some educator specific resources. If I go to complementary resources, it takes me to the faculty educator resource. And here is the teaching content. Under lab handouts, here's the assisted devices lab handouts. We have essentially created generic lab handouts for you to use. We have little worksheets that students can work through. Here's the parallel bars. What are the proper measurement angles? The affected lower extremity for appropriate assisted device placement. What is the weight bearing status? And they can click directly into the link to self-explore all the information that they need. So we have these worksheets that the students can do. This is how we have them pre-use the app to begin to populate their mind with the knowledge. Then you have, for example, here's all my transfers. Here is a transfers worksheet. We built it as a Word doc as well as a PDF. You can absolutely take the Word doc, modify it to your need, and then put it into your LMS, as a lab handout. So it's up to you. We just didn't feel like everybody had to reinvent the wheel. So here you can see transfer preparation. Here's gait belt fitting. Here's the setup. Here's right lower extremity non-weight bearing for stand pivot, the indications, equipment setup, patient position and cues, therapist position and guarding, and the students, they just know before they come to class, they have to pre-watch and look through this lab handout. When we come to class, the faculty member, myself included, we always have PhysioU up on the web. So I just bring this up. We watch it together.
The following is how you would perform a stand pivot transfer. You will first begin by having the wheelchair as close to the strong leg as possible. And then you're going to have your patient scoot towards the edge of the mat and then lean forward as they stand up on the strong leg. And then you'll have them pivot towards the chair, assisting them as necessary. Reach back for the handle, lean forward as you slowly lower yourself down into the chair.
So those videos are all filmed. And the other thing I would say, so if we go back to transfers, there is always this transfer preparation video. So we could take a look at that real quick.
In order to prepare for a transfer, you will first need to completely remove both of the leg rests and set them aside. Place the chair as close to the surface as possible. Lock both of the brakes and ensure that the surface is stable.
So we purposely did that as a separate video because it's relevant for every transfer, which means that when you actually go into the app to watch the different transfers, and you can see we filmed all the different variations. And the reason we filmed all the different variations is because not only do our students use this to learn in class, but they will also use this as something as patient education. So this video here the student can actually go in and create an email and send this video to the caregiver or to the patient or the patient's family. So you just create an email, and then now you can send this directly to the patient. So it is not only a classroom use app, it was designed to help with training the patient and the caregiver in the clinic or in the hospital. And it was meant to then be shared with the patient. Patients can view this video. They don't need any type of subscription. This is just part of how we view the use of these learning tools and how they carry into the clinical setting. So I think that's a very important part, where the students don't just put resources away when the class is done. They continue to use the resource throughout their entire educational experience, and hopefully into the clinic as as a professional as well. So that's the transfers component. And what I just wanted to show you was that we have these worksheets created for you for pretty much everything you would teach in this particular type of class. The other thing I would say is, I'm going to create a Google Doc here. This can be another opportunity for you to augment your LMS or lab handouts. And what I mean by that is every single technique that you see here, you have the ability as an educator to copy the page title with link. So let's actually go over here. I'm going to go to gait patterns. Here is 4-point gait. Here is axillary crutches. And I'm going to copy page title with link. I can now paste this into my existing lab handout. This already has the link directly to the video. So any of your lectures or any of your lab handouts can have videos directly linked to the PhysioU resource. So there you have it, straight to the axillary crutches 4-point gait. And you can also copy the thumbnail image. So if I go back to here, you now have a matching image tied to the title that is hyperlinked. So again, you can make all of your lab handouts. If you don't want to use the ones we've already pre-made for you, you can absolutely do this for your labs, for your lectures. All you would have to do is click and it will open up the video. So as long as you're logged in as a faculty member. Students, as long as they have their own sign up, their own PhysioU subscription, they have access to all of this. This is the whole point, is that they have access to this knowledge before, during, and after class, all the way into their clinicals. So let me move on. Actually, let me stop for a second and ask if there are any questions so far. Please feel free to unmute yourself. Any questions or comments, James?
None yet, but I just put a rhetorical question out there. Not rhetorical, but an open thing that anyone who's using this already, or I'll add to the question of do the folks in the call right now, would you anticipate that doing this would make it easier or more efficient teaching if the students previewed it, and by the time they come to class with you, then they already have an idea of what you're going to be talking about?
Hi, I started using PhysioU last year with my PTA students, and I was sending links to the various videos that I wanted them to watch, and then we would open the videos up in lab and work through them that way. What I didn't realize, which I'm so super stoked about, is that we had the handouts and the lab sheets, because I went in and tried to recreate all the lab sheets, and it was just a tremendous amount of work. So I'm super excited to see the consistency of the same language, same videos, everything. I think that will be extremely helpful. And then I didn't realize also that you could email your links to your patients. I mean, I'm just finding out that PhysioU has so many more applications than I even realized that they had. So I'm
wonderful,
super stoked.
Wonderful. Yes. Wherever we could, wherever we could find places that lab handouts are very generic, like physical agents, like neuro, cardiopulm, assisted devices, range of motion, MMT, PNF, we created lab handouts so that everybody could use them and wouldn't have, we believe faculty are working hard enough. And if we are able to create consistency also in the way the lab handouts are created and how they're linked to the videos, the students also begin to, it lowers the level of anxiety, I think, when they move from a physical agents class or range of motion MMT class. They feel the exact same way and they know exactly what to do, right? I mean, that's, I think, one of the challenges as students move from professor to professor, which is, there's nothing wrong with it, but I think we should all recognize that every time they move into a new house for a semester, they've got to open drawers and figure out where everything's at. This can help with that. And we hope that that reduces the faculty burden. And Debbie, I think the little sidebar that allows you now to, I think this allows faculty to easily add content to their existing resources. So this is why we built this. The other part is, for example, having the students know that this video, how I teach the patients, I think the students need to hear it. This is the way we would teach the patients. You watch the video together. And after you watch the video together, you send the video home with them so that they can continue to follow up and have this resource supporting them as they leave your clinical setting. You've expanded the window of your clinical care beyond the 30 minutes or an hour that you have with them. So I think faculty, now that you know that that exists, I just tell students, this is my practice pattern. Whenever I have a chance to improve patient education, I use any of the videos in PhysioU and send it to the patients. So what you see here for stairs is, of course, there's preparation for stair training. And then there's the stair training with various devices and various, of course, the right extremity affected or right lower extremity non-weight bearing. We filmed every single possible iteration, right? So it's right or left extremity, either the extremity is affected or it's non-weight bearing. Each of these are specific videos. So it really can function as a clinical utility tool. So let me just show you this real quick.
As your patient goes up the stairs with crutches and is non-weight bearing on the right leg, have your patient first push down into the crutches as they step up with their left leg. And then the crutches will follow. Continue with this pattern. Push down into the crutches as you step up with your left leg. And next, the crutches will follow.
So you watch it with the patient. The students watch this before they come to lab. They come to lab perfectly equipped. The other thing I think this allows us as instructors to do is it allows us to build on what is already softly scaffolded in their brain. Meaning lab time does not have to be the first exposure for all of these techniques. Lab time actually is a very powerful moment for faculty to replay these videos, talk about different nuances and develop their clinical reasoning, and to add in some of the other nuances that faculty have related to their own clinical practice. So, if I segue actually back to gait patterns for a second, I remember talking with Grace about how challenging it is for a student to read about what is a modified 3-point gait, what is it for? So we have a little short explainer video, 18 seconds.
For a patient that has one leg affected and the other leg is full weight bearing, modified 3-point gait can be used using either a walker or crutches. For a patient that has no weight bearing restrictions, bilateral canes can be used.
Yes, actually, I just saw someone raise their hand. Please feel free to unmute yourself and ask a question. Is it Bjorg? Any comment? Okay. If you have a comment, please feel free to unmute yourself. This is a small group, so I'm happy to pause for a second and chat. So the students watch all of this in preparation for class, and then you have all of these assistive devices, right and left, and the video of the instructor teaching the patient, including the cues and some alternate cues. So all of this we would watch with the patient. We would then send them home with the video right here. And that's how you can create clinicians, part of how you can create clinicians. Let's move on to bed mobility. Here is preparation for bed mobility. Here is rolling and scooting supine to sit. So we can take a look at that.
To assist your patient from the supine to sitting position, you will first begin by asking your patient to bend both knees up one at a time. You will then ask your patient to reach towards you, and you will assist them at their shoulder and their hip as you roll them towards you. 1, 2, 3. Next, you will ask your patient to assist you by pushing through their elbow and their hand as you assist them at their shoulder and their legs and sit them up in one fluid motion. 1, 2, and 3.
Okay, so again, there's lab handouts for this. They have watched all of this before coming to class. That's a prime time for either, there are two ways to do it when you come to lab. You pull up the video, you watch it once, you stop the video along the way, add some comments, and then you bring the student up and you demonstrate in real time. So I think those are just some different ways that you can leverage the app into the classroom. The nice thing about these videos is generally everyone has a good view. In our labs that have 74 students, no one has a good view when I'm performing it at the front. So we watch it all together on the big screen, and then we demonstrate a lot of the techniques after we have talked about it using the videos. So really, if you think about the videos, they are your assistant. They are there to make your labs run more efficiently, to give you a little bit of a breather or a backup, and also as a way for you to talk about extra things. As I mentioned, all of these little nuances. So here is all of your little bed mobility, scooting up in bed with a draw sheet, down in bed with a draw sheet, side to side.
In order to move a patient using a draw sheet, you will first start by positioning the sheet between the patient's mid-thigh and mid-chest. You will start by having the sheet rolled up on one side, and then you will roll the patient towards you as you tuck the sheet in as far as you can underneath the patient, and then the patient will roll to the other side, and you will pull the sheet through. In order to move a patient upward in bed using a draw sheet, you will first roll the sheet as close to the patient as possible. Next, you will grasp firmly the sheet and ask the patient to bend both knees up one at a time, and also raise the head if possible, and on a count of 3, slide the patient up. 1, 2, and 3. You can repeat this motion as needed.
So imagine trying to set this up and doing this and trying to get a good view for all of your students. Not so easy, but with a video, again, you can stop the video at any time, create discussion, talk about different scenarios. All of that is now, you're able to do that easily because everything's really at your fingertips. Any comments or questions so far about what I've chatted about, talked about?
The chat is clean.
Good.
There's nothing.
So, and I think this is all very straightforward. I hope what faculty are taking away from this is there is a vast amount of material at your fingertips, organized in a very easy to access manner that can support you as a faculty member, make your life easier, and in fact, make you probably more effective and the students have this exact same resource in their pocket all the time. So if you think about sit to stand and stand to sit, we have all of these accelerated crutches, lower extremity, non-weight bearing, right and left. These are all videos that we would train our students with and train our patients with, as well as email to the patient. So you have these sit to stand, we have transfers, all these different types of transfers. Maybe I will just do one of these.
If your patient has weakness in both extremities, you can guard both legs at the same time. Okay, we're going to transfer to this chair. Count of 3. 1, 2, and 3.
Okay. All these different transfers are available. Students have watched this all on their own. Let me move into wheelchairs. For wheelchairs, what we've done is we've created short videos about what they're for, factors to consider, and also all the basic fitting concepts. They can watch all of this on their own time. Components of a wheelchair. And then different forms of propulsion.
You can use one arm and one leg to propel the wheelchair.
And you can also, you have all of the mobility. So up curves, backward, forward, down curves, up and down ramps, through doorways that open away, through doorways that open towards. So all of this has instructions, the therapist cues, and as usual, the faculty member, of course, can be talking through all of this. Lastly, before I take you to the simulations and the knowledge micro learning component, we've built short little case studies. So philosophically, I believe that it's so useful when the students have acquired the knowledge that we give them opportunity to apply that knowledge. So these case studies are very light. They're very simple. There's some very basic objective findings, knowing full well that they're probably doing a range of motion MMT class or have recently finished it. And then we ask some basic questions. We tell the students they're not allowed to look at the answers. We want them to discuss it in little groups. And as a faculty member, while they're discussing it, you can take a look at all the answers that are already written for you. What gait pattern would you use? What's the cues for this gait pattern? So it goes all the way to stair training. So each of these little games are meant to take what is very basic didactic knowledge and turn it into basic clinical settings. Some are acute care based, some are more orthopedic, some are perhaps neuro based. So we have a bunch of these little games here for you to utilize in your classroom. So again, it becomes a tool to create engagement and develop clinical reasoning.
Mike, I got a quick question.
Sure.
From Sumaya, she asked, and she may have to unmute to qualify because I'm not sure. Is it possible to tell learner in which situation this position is contraindicated? I don't know in reference to what position that her question is stating. So Sumaya, you may unmute and ask your question better than I can
Yes.
understand it.
Hi, how
type.
are you?
Hi, Smaya. Good.
My question is this, as you show the video regarding the draw sheet related, sometimes in some situation this is contraindicated. So is this possible to make a box or a draw box in which that this position is not usable or contraindicated?
So I think are you talking about maybe down here in the text that there may be some reasons to be careful not to do it?
Yes,
Absolutely.
yes.
James, if you'd make a note of that, I can talk with Grace and we can look through all of these and just see if we can add in some extra notes where people should be extra careful.
One more thing, if you don't mind, can I ask?
Of course.
I already tell in the chat box that related all your cues, I make the checklist for the students to go through that, and according to that checklist, I will assess them. So this practices I'm going through.
You mean these handouts?
Yes, I made the checklist by myself to recreate the checklist,
Yes.
and I'll give to the students as well. When I do the assessments, examinations, I tell them that these are the cues you need to follow accordingly.
Perfect.
And according that you can assess.
That's a great idea. That's
I think the students love having very, here's a 12 things you must make sure you do or say, and then
Yes,
they'll know that.
exactly.
And they go, hey, and that way they go, I got a fighting chance. If I get this right, I know I'm going to pass. They're so worried about missing something there. So that's a great thing there. The other thing too, about like the contraindications and stuff, there's always going to be stuff that as the instructor, I think it is valuable that you add your information. This is a good a basis, or a good foundation to start the discussion. But by no means does PhysioU apps ever replace the teacher and you being able to talk to them. Now, what are the contraindications to using a draw sheet and things like that? You saw blah blah blah, and you can always, and that's, I think, the beauty of this is that it augments our teaching. It doesn't replace our teaching.
right. Great. Any other comments, Debbie?
Yes, I was wanting to go back to her statement about using the check sheet, because like I said earlier, I made my lab skill sheets and they have information about contraindications and safety issues. And so my mind is just reeling right now, going, oh my goodness, how can I incorporate this and change everything up?
Yes.
So I definitely need to make sure that I incorporate indications, contraindications, especially for my physical agents, and then any safety, red flag safety issues. So my question is, was she using the lab sheet and then just making a separate checkout sheet for competency for her students?
Yeah, Sumaya, do you want to chime in there? Were you using a separate lab sheet and then you had a separate checkoff sheet so that students would know that they...
No, it's not like that. It's not like that. All the therapeutic cues and all the cues that related to the therapist and the stepping, I made that is specific steps in a list form. And that list, exactly your list. And that list is shared with the student for examination point of view. I will I will see this, is this accordingly you fulfill the criteria, then you will pass for the competency. This is a competency, an expected competency from the learner side.
Okay.
Thank you very much. One more question, if you don't mind, and it's kind of going a little different route. Can you show me again where you found your case studies?
Yes, if you just go to the main app, you will see case studies down here at the bottom. So here's all the main categories of the app, and then case studies are here.
Thank you.
Yep. So basically, Grace, myself, and some of our instructors got together and we basically reproduced a lot of the basic cases that we like to use to illustrate the clinical reasoning behind the choice of gait pattern, the choice of, assisted device. And all of these are here now as just They're just little ways to create interaction over the knowledge. And I think that's helps the student at the synthesis level versus at the lower Bloom's taxonomy level of learning. So let me spend the last few minutes here showing you what we've just released, in fact, today, because I told the team I'd like to show faculty what is here now that students can do. We have both micro-learning and mini sims. Micro-learning is more self-quizzing. So let me just give you an example. Everything that the students are going to learn in that class, we have created self-guided experiences. So I'm going to take gait patterns, for example. Faculty members who log in have the opportunity to scan the entire game. So you go to show course key. I'm going to make this a little bit bigger for you to see, and I can just click through the whole thing. Here is what the game is. Here is what the feedback says. And now I can see the entire thing in a minute, every part of the game. Which of the following assisted devices are appropriate for a 2-point gait pattern? Which option describes ambulating with a 2-point gait pattern? So you teach them what they need to know through pre-exposure, face-to-face lab, and at the end of the week, they play these games to solidify their knowledge. When they are done playing this game, what you will see is at the very end of this game, there is a summary of the knowledge that they needed. And there was feedback along the way as well. There was feedback along the way as they were playing. So here's the summary. When the summary is done, we ask the students, what you can see here is there's a learning history. You can see every attempt that I've made at playing the game, how long I took, and what my scores were. So we ask the students to turn it in. This is their quiz. This is how they earn a few course points. So when you download the learning report, this is what you as a faculty member will get them to turn into their little Google Drive or your LMS little Dropbox. This is the game they played. This is the learner's name. This is when he did it. Here is his last 5 attempts. I just tell the students, if you want to play it until you get it all right, great. You're going to get the highest score. This is all low stakes learning, but I think it's something really important. You can see that it's the whole reason why we keep building this for so many of the different content areas, because we believe that students need to play with their knowledge in low stakes ways. So under microlearning, there's games, assisted device adjustments, bed mobility, guarding, transfers, weight-bearing statuses, wheelchair mobility, wheelchair parts and fitting. All of these are now here, vetted, ready for you to utilize and take your students deeper into their learning. The other part here with mini sims is we've created a slightly more interactive, clinical scenario-based patient. And I will just take you through the course key briefly. Here is your patient. And here are the objectives. Choose the correct assisted devices, choose the proper donning and doffing of techniques for lumbosacral orthoses, identify indications and precautions for lumbar sacral orthoses, and then identify the correct techniques to be used during functional tasks and gait activities. So as the student plays through the game, it should take about 10 minutes. And it starts with a scenario. And the student will read the chart review. We'll talk about what brace, what might be the indication for this brace. And remember that there is feedback here that the students get as they play through the game. So it is partly formative, partly summative, but all designed to help the student learner take their knowledge and apply it in a clinical setting. So what is the proper position for donning and doffing the LSO brace? And you can essentially play through this entire game, watch a short video, and then have questions based on that video. So which of the following techniques should you advise Jerry to use to move from a supine position to sitting at the edge of bed? Teach the patient to use the log roll technique. So I guess what I would advise you to do is feel free. I mean, these are short games. Feel free to play through them, know what's in them, and then assign it. Assign it in your LMS for module 4, for week 4. Say, hey guys, at the end of this week, we've talked about all of these things. I want you to go through and play this little game. You're going to get points for it. You can play it as many times as you like. In the end, the endpoint learning is going to occur. So to me, lots of times this type of interactive knowledge checks or these little simulations really help the students in a low stress, low risk environment apply their knowledge and slowly become the clinician. So that's pretty much, I'm going to take us back to here. That's pretty much all I have to share with you related to, if you go to PhysioU, you'll see all the e-learning components we added this year. Acute care interactive review, assisted devices, neuro, ortho, physical agents games, range of motion games, wound care games, right? So these are all here for you to leverage into your classroom, and they're all vetted by professors. So we're very careful about putting things out there that you can't count on to be consistent with standard practice. Let me just pause here for any comments and questions. Any thoughts, comments, or questions?
Sorry to keep being a microphone hog, but I do have one other question.
Sure.
We also use a electronic documentation system.
Mm-hmm.
So I was kind of thinking that perhaps some of the games at the end, they've already created this patient, they know what they've done, you know, so much, and then we can have them do a documentation of that treatment in their
I love it.
documentation system. But I wondered if any of your games have that as a follow-up. So you have this patient, you have the scenario, and then now we're going to document based upon what you did with this patient, and so we can kind of close that loop.
You know, we could totally do that. We could build it into the game. So at the end of this game, so if I go all the way to the end, let me see here. So at the end of this game, there is no documentation component. We could certainly put in an open text field that says, please document what you would document for this particular scenario. I would have to play through it and talk with the team to see if that would make sense. Now, it's not as slick as you having them use a fake EMR to try to document. It may be still useful because when the student submits that document, you'll be able to see in their learning report what they had written. So I'm curious, Debbie, of your thoughts. What if it was just an empty text field that says, please document how you would document related to this current patient scenario?
Well, I think there are a couple of things. One, it would give me an idea of where their thought process is. And then also if they're placing information in the correct category as far as a SOAP note. And then at least that way I can use it more as a check and balance. So now I know where the students are at. So maybe I need to come back and revisit some things before we go into our EMR section.
That would be fairly easy to do. Would you prefer it as 4 separate open text fields? The first one says, please document the subjective portion of the SOAP note. And then there's a text field. So they finish that. You know, it's kind of like a Dan Brown chapter. It's short, it's sweet, you know exactly what you're supposed to do. And then you move on to the next slide. Please document the objective portion of the SOAP note. And so it becomes 4 separate slides instead of one slide where they have to put the whole SOAP note in one place. What's your thoughts?
I like that idea, mostly because at least at the beginning of this process, I think if we can take that elephant and let the students take one bite at a time, it's not quite so overwhelming.
Absolutely. I love it. I'll talk with the team about it. That should not be difficult to do. I just have to think through as they play through the simulation, whether it fits. Is there enough information? Is there enough things that they've done in it that would justify writing up a whole SOAP note? If it does, you can expect to see it probably within the next week or 2.
Okay, great. Thank you so much. Appreciate it.
Absolutely. It's a great idea. Great idea. Other comments, other thoughts? Please feel free to unmute yourself. This is just kind of the point in the webinar where we just like to connect with faculty and get these brilliant ideas, or any thoughts or things that you want to see that I could show you as well.
Can we look at the physical agents simulations?
Yeah, absolutely. I know many of us teach in certain clusters of classes. The physical agent simulations you'll see cover little short patient cases. So I'll take ionophoresis, for example. Here is the learning history. There's a few cool little things. Now, forgive me, I don't remember all the answers to this. I'm just going to jump through it so you can see what it's like. So you have a patient who says, hey, I'm having some tennis elbow problems. I use my hands a lot, use my arms a lot. Please apply a physical agent to help reduce your symptoms. You decide to use ionophoresis. So here is what are some contraindications. So I'm just going to keep going through here. And then you decide, you note redness, swelling, and decreased grip strength. So we've tried to show the student that there is inflammation as one of the issues. So please, which medication will the physician most likely prescribe for this patient? So which of these is anti-inflammatory? What's a good position to put the patient in? So I'm going to have them seated on a chair with feet flat on the floor. You're ready to begin the treatment. Click on the active electrode to proceed. Black is negative, red is positive. The patient only has about 15 minutes for treatment. What amplitude would you need to set? So we know it should be about 40 milliamp minutes. I'm going to go for the 3 milliamps. And you may want to increase the amplitude. So we put this here so that the students become familiar again with a device that they only had one chance to play with in lab. So which of these are they going to turn? They're probably going to click on the amplitude current button. After the treatment, your patient complains that her skin hurts. You lift the electrode and observe a light burn. To prevent a burn from happening again, how should you change the parameters? So you can see these were designed to help with clinical reasoning development. So I'm going to decrease the amplitude and increase the time. To increase treatment time to 20 minutes, what amplitude would you set? Great. Please adjust the parameters. Your current dosage is 20 milliamp minutes. Please set the current to the appropriate dosage. So they slide the slider until they get to the appropriate dosage, and then they submit it. It's a seemingly simple and kind of brainless activity, but I think it does something for their brain. It makes them familiar with how they're going to use the device. And then at the end of each game, there is typically a review slide that connects them to all of these basic knowledge. Every single one of these games is like that. When they're done, they can either review what they got wrong. So they can click through all the different slides. And then I'm going to click out of that. And their score is now recorded here. This is me. So every single one of these games that you see here now, you have traction, cold pack, hot pack, IFC for upper extremity and low back. You've got ionophoresis. You've got NMES, TENS for the low back, ultrasound. The way we would use this is at the end of ultrasound week, this URL is plugged right into their e-module or into their LMS. So you just copy page title with link, and then you add, guys, you have homework to do. You have a game to play. Make sure you finish the game and turn in your learning report. Does that help, Debbie?
Yes, that's great. Thank you so much.
Isn't this kind of cool? I'm so excited about it all the time.
The one thing that the iontophoresis did not demonstrate, because there's not that long of a setup. As you're looking at the cervical traction one, Mike, you can share with them that you have like kind of a fast one, like a quicker, the shortened version of the cervical traction that just shows them. Isn't this the one that?
Well, that's in the app itself.
Oh, okay.
That's in the app itself. So Debbie, you've used the app itself, I imagine.
I have, but not to this extent by any stretch of the imagination.
Right.
And I'm just thinking about all the years that I have gone in and found different videos. I have like a library of like 50 videos of different things. And so I copy and paste and open and close. Oh my gosh.
Yes.
I love this. I'm so excited. And I'm also thinking too, of course, we're always concerned about being cost effective for our students. I'm pretty sure I'm going to have to dig around a little bit deeper into this, but I may be able to discontinue one of our books and just go simply with this.
Yeah, absolutely. If you think about how many content areas this covers, you can easily eliminate 1 or 2 or 3 resources that you don't think will be a detriment to their ability to pass the boards. I mean, adaptive equipment or assisted devices. I guess all I can say is I use textbooks in my class because textbooks bring a certain level of depth that the apps were never designed to do. But the textbooks could never teach motor skills like apps can do. And so when you think about what resources, how do we reduce the debt burden on the students? You think about resources that I used in the past, but I just don't use it much, and it doesn't do the job that well. That's how I make that decision for our students. And we have saved our students lots of money by utilizing this resource.
Well, one of the things that we're finding is that our students are just a little different than they were back in my day.
Yes.
If I was told to read 100 pages, I would stay up all night, I'd read 100 pages. I had a student probably about 5 or 6 years ago that came in and said, gosh, Miss Paul, is there like a video on YouTube I can watch to learn this skill? And I just wanted to throat punch him out the door. And I thought, no, you cannot be in PTA using YouTube. But then I had to stop and go, okay, now who am I teaching today? And I'm teaching the kids that watch a 2 or 3 minute video for everything. And that's what they learn. And so my expectations for them to read the textbook is not what I'm getting. And so I'm just not getting that. And I've tried various ways to make it more high stakes to try to make sure they realize how much they need to get it. It just, I'm having a hard time getting them to flip over to that. So with that said, I think that I will have more compliance and I will probably have better retention.
Yes.
More videos.
Yeah, I think so. I mean, trying to organize videos from all over the place of varying quality is really a nightmare for faculty. So this is a significant problem we've tried to solve. And as you see how we're developing the e-learning components, the videos are just not enough to create clinicians. Clinicians need to play with their knowledge. That's why I think simulations is part of the future of education. We are really just at the early point of trying to figure out what simulations are, how do they work, how should I make them? And the general ways we've done simulations are typically paper-based, fairly time-intensive if you try to really make them really nice. So what you're seeing with what we're doing is we are experimenting by your side, listening to your feedback and giving it a good go at something that is scalable, meaning every program in the world who wants to use PhysioU can now leverage these instead of trying to figure out how to build them from scratch. So I think you're right. This generation of learner, they sat me down. They said, Dr. Wong, We don't buy the textbooks you ask us to buy. We share them. We read a little bit. If we don't think you're using it in your class, we junk it. We don't spend time on it because we got 4 other instructors telling us that we have things to do. So I think we also introspectively have to think about our mechanism of teaching and who these learners are and meet them somewhere in the middle. I tell them, I explain to them why I asked them to read chapters, because these apps were not designed to bring them to that level of depth. If they want to become clinicians, they got to build their knowledge base. But there are certain things that I don't have them buy anymore because they can learn it better with these videos. So I totally agree with you.
So one topic that I'm not seeing on here is soft tissue massage. And
Yes.
that's one of the topics that I teach. There again, trying to find videos are challenging because most of them are massage therapists, and sometimes they get a little out there. And so obviously I do demonstration in class, but that certainly would be a topic that would be useful, I think.
It's on my list. We actually chatted with a few faculty from San Diego State University, and we've started to mock it up. So we're working it up, we're designing it, we're trying to figure it out. It will be evidence-based as best as we can make it. It will have the basics, effleurage, petrissage, cross friction. It will have evidence behind it. And we're trying to figure out, it's kind of a slippery slope, you know? It's like, whose technique? What technique do you show? How many muscles are you going to show? Most likely what it's going to be is based on the most common muscles that we teach in the classroom, there will be example videos on the application of various different types of soft tissue mobilization techniques. And we will try our best to back that up with some evidence. It's on my list. It's on my list for this summer, actually.
Wonderful, thank you.
Yeah, Debbie, actually, if you don't mind reaching out to me on a separate email, if you just email me in fact, it's easier to email me at mike@clinicalpattern.com, which is, we've kind of moved our domain name. So mike@clinicalpattern. I'd love to kind of pick your brains a little bit about it. Soft tissue can be just massive or really, really clean and really simple, just enough for faculty to be able to teach the basics. You know what I mean?
The challenge that Mike has and I have in helping Mike develop it, and when do you say when in terms of should the hand app be that which is at the level a person who completes it is now knowledge base of a certified hand specialist? These are entry level applications. So do we add dry needling to the soft tissue? You see how it just starts slippery slope, migrates all the way to that. And so it's a challenge. But we do appreciate, matter of fact, any other topic ideas or areas of clinical practice that you think would be warranted in this type of an app for the entry level education would be very helpful if any of you guys have any other. Also, the contact information from Mike I put in the chat early during the webinar today. So if you want to scroll to the top of the chat, you'll see his contact information.
Yeah. So Debbie, let's reconnect sometime in the next few weeks, and I'd love to pick your brains about it a little bit.
Absolutely, thank you.
Wonderful. Any other comments or questions before we close out the webinar? Hey, thank you so much for spending the day with us, the morning and afternoon for some. March 11th, next week, I will be talking about the CardioPulm app, it's an amazing app, the Lines and Tubes app, as well as all the acute care interactive review components, which are, I think, amazing as well. So looking forward to chatting with you again. Please feel free to reach out to me. I love connecting with faculty. I can hear a little bit about how you're teaching and give you advice about how different programs are applying these apps to enhance learning for their students. So hope you guys have a great weekend and look forward to seeing you in a few weeks if there's another topic that you are interested in. Thank you, everybody.